Hi YouTube, my name is Michelle. I am signing in from Pittsburgh, Pennsylvania. This is my first video for the weight loss community. I am in the very beginning stages of weight loss surgery. I'm in a program at McGee Hospital here in Pittsburgh. They have you go, my insurance and them have you go through a 6-month diet and exercise program before you can have any type of surgery. I have not yet made up my mind what type of surgery I want to have, but I do qualify as far as my insurance is concerned. And alright, I haven't been pre-approved yet, but the guidelines, I fall into them, and it looks very promising. So as of July 27th was my seminar date. August 13th was my first weigh-in. And then I have 5 more weigh-ins, and then I can have surgery after the pre-approval. At 3 months I have to talk to a surgeon, and then after I talk to my surgeon, I'm sure there's a whole gamut of tests that's out there after that, which I haven't gone through yet. I'd really like to document this for people that are looking into weight loss surgery because of the new guidelines of having to do that 6 months exercise and diet program. Right now I'm writing down everything I eat. I'm wearing a petameter, which I took off because it's digging into my side when I sit down. So I try to remember to put it back on. Yesterday I had 5,500 steps. Today it registered that I had 980. I don't think that was right at all. I don't think it was working today for some reason. I'm going to have to figure out a way to wear this that it makes that little noise. You hear it? That's the sound it has to make. In fact, the package said one of the places that you can hook it was on your bra. And I am not comfortable with having a big square thing right in the middle of my bra all day long jingling. So I'm going to have to figure out a way to wear this so that it registers my steps, because I know I walked more than 900 steps today. Who am I? I'm a mother. I have 5 children. 2 of them are stepchildren. 3 of them are mine. My daughter's 19. I have stepson 16, another stepson who's 9. My boys are 5 and 3. So between 19 and 3, I have one going into the 2nd year of college this year, and one starting kindergarten this year, and one not even in preschool. So we've had a little graduation in our house. This year we're not in diapers, so we're saving some money there. However, we're wearing nighttime pull-ups still. But that'll soon pass. It too shall pass, as they say, you know. He won't be going to college in a pull-up, I'm sure. My daughter is currently in the United States Army ROTC program in college, and she will be graduating as an officer. And the other children don't have any aspirations about what they want to be when they grow up, and the 16-year-old is getting kind of close. I'm married. We live in the suburbs. I have a dog. I have a job. I have a job that I work with clients, and I'll talk about that one day because it's a huge part of my life. I probably work 50 hours a week, even with 5 children, and it's a very stressful job too. So we'll talk about that later. Why am I doing this? I'm doing this because I have a history. My whole family has a history of weight-related problems. Everything from hypertension. My mother has diabetes. My dad died at an early age of a chemically caused cancer. So obesity didn't kill him, but obesity kept him from getting an early diagnosis, if you're following me. If he would have been a fit person and going to the doctor regularly, I truly believe this could have been caught earlier, and maybe Dad would have had a few more years with us. 58 is a very early age to die, and I don't want to do that for my children. I'm 38 years old. I have, like I said, my youngest is 3, so I need to live to at least 68 to see him be 33. that is a good goal. And, you know, I'd love to live to be 80 or 100. But to do that, I got to get this weight off. So I'm looking at myself as trying to live for my children, trying to live a healthy life, trying to live a chemically free life right now, because I had kind of a breast cancer scare earlier this year. I had some precursors of breast cancer going on, and they ended up finding out that it was in my skin. It was calcium deposits in my skin and not actually in my breast. But I took it as a really good indication that I probably should try to eliminate chemicals from my life. So we've been eating organically and naturally. We've made a lot of good healthy choices that way. Trying not to drink chemicals at all, trying to stick with water, giving up Diet Coke, giving up any type of diet soda type stuff. My kids, I've noticed that since I've had them on organic drinks and less sugar, that their behavior has improved for the 3 and 5-year-old. And in fact, when the 3-year-old, when we were on vacation, they were drinking Sprite when we'd go out to dinner. Just tired of water on vacation, so I gave in. And ended up bringing home my 3-year-old and having to take him to the doctor because he was having bladder issues. And they think it's probably caused because I switched him from no chemicals to chemicals. And I know that sounds strange out there, but it's doing stuff to our body. It has to be. So that's pretty much why I'm doing it, if I made any sense. I'm doing it for health reasons. I'm doing it for, I want to live longer. And right now, personally, my knees hurt, my back hurts, I'm tired, I have bouts of depression that are pretty bad. My self-worth is not there right now, and I want to love life again. So that's why I'm doing it. When? I have 5 more weigh-ins to go, and I have all the gamuts of tests, which I really don't know what they entail right now. I have to meet with the surgeon in 3 months, and hopefully in February is when I'll get to have surgery. Which one? I don't know. So walk with me through this. Help me figure out lap band or gastric bypass, and listen to me ramble as I work this out in my head, because it's not an easy decision, and it's not one to be taken lightly. So I look forward to getting to know all of you, and thanks. Bye.